is on vacation right now, but we were able to check in with, I'm looking for the email that he sent me. We were able to check in with Heidi Mathews, that's who it was, and to get an update of where the hospital is. And her feedback was that staffing continues to be an issue for the South County Clinic. The clinic is currently only open 2 days a week due to the provider who's out without a known date of return. And so she asked for more time until she is able to get more information about a provider. And ideally what they're trying to do is get the clinic back to being open 4 days a week before they commit to being in place for the naloxone receipt and distribution point. So that's what I have from her.
With the unknown of the former provider returning, I know there is someone there who's 2 days a week. I guess that person is temporary. Do you think, oh, I guess you don't know, they might add a second person to flesh out the 4 days or just extend that temporary person's?
So I don't know. And that, you know what, that's a question I'll email back and ask. I expected Dunya Fole had said that she would be at this meeting. So maybe I'll CC her on that question as well to see if we can get an answer back from folks and bring it back to you or send it out to the group as soon as I've gotten some information. Because you're right, I've been trying to think of what other, what other ways we could accommodate. And I know we've talked about maybe having the fire station, but I know that the next thing on our agenda is Dr. Carlbom giving us his update about what's going on that front.
Sure. I don't have a ton of new information. I met again with who did I meet with? The MSO or sort of EMS chief, I guess EMS battalion chief from Tacoma Fire. Sorry, I don't have my notes in front of me. Who runs their harm reduction program. Tacoma has a very savvy sort of opioid overdose response where they send their EMS team. They also have 2 nurses that work, 1 nurse at a time in like a mobile van that does Suboxone microinduction, sometimes staying with the patient for 3 or 4 hours, which is amazing and sounds expensive. And not something I think we have resources for in our county right now. And mainly I want to talk to them about this idea of having EMS leave behind Narcan for people that they either wake up with Narcan, naloxone, and the patient wants to stay at the scene, or someone who uses their own home naloxone to resupply them. The requirements are very simple. The UW has a program, and there's a grant funded program through the state that the grant should get renewed in October, where we could basically get free naloxone. We just need a place for it to be delivered to. All we need to provide is education. Those materials are available. The state has online education that we could have sort of a slip of like, go to this website. And I reviewed that. It looks good. It's in English and Spanish. The UW's Center for Addiction Medicine, I forget their exact name, sorry, has a
ADAI maybe?
Yeah, they have a couple sort of leave behind documents that not only about opioids, but they have one for meth, which I thought was would be a good fit for us. Mm-hmm. Those we would have to print, so I don't know what cost that would be. Sorry, theirs we order from them and they will get them made for us. The state one we would have to print ourselves. And I found on Twitter of all places someone who has like a plastic little toiletries pouch sort of thing that they bought for like 99 cents. So as we get closer, I can message that person and be like, where did you order, on Amazon or whatever, like 100 pouches for $1 each that you can put the drug in and the flyer and give it to someone. And so the next steps are I need to write a protocol for the criteria of, who fits for the EMTs and paramedics leave behind. And then I need to make sure that the whole EMS community is aligned, which means not only Chief McKern, but all the other chiefs, and work on that, ideally at the sort of EMS council level, which we'll meet again in the first Tuesday of September. If I get closer on writing the protocol, which I'm a little bit behind, I can maybe chief do some of this work by email. I'm thinking is emailing folks and getting feedback on the protocol and input. I think it will be pretty seamless, and I'm going to lean on East Jefferson maybe to be the receiver of the drug and coordinate distribution to the other fire districts. They have a new MSO, which is like a officer in charge of EMS. That would be a perfect fit for her to do, and it would just be, all we have to keep is if you used one, who you gave it to, and if you were resupplying or a new person. That's the only statistics that they want. So for the free naloxone. So we're on track. It's moving a little slow. I also am working on lining up a couple speakers to teach at our EMS base station meeting. I was thinking October, but probably November, on how to talk to folks about drug use. And, you know, so you've overdosed, now what? So that we better prepare our EMS teams to have sort of professional and non-judgmental conversations with people about this, and the ADAI folks are happy to help teach that. And so, and there's someone at the state who is also willing to help teach that. And they actually have some sort of, you know, recently recovered opioid use disorder folks who are happy to talk about their experiences. So I think the whole education package should work pretty well. Frank, thank you for searching Amazon. I appreciate it. That's awesome. Yeah, I think hopefully maybe a go live of November, mid-November. I'm sorry it's pushed back a little bit by summer, but that's where we're at with that.
Well, we're really
And
happy.
Chief, oh, sorry, I was gonna say Chief McKernan, I might have surprised you with some of that, so I'm not sure. Hopefully that's okay in your view. Chief McKernan is the co-chair of the EMS Council.
See,
We're fine. You're doing just great. If we need to do an August meeting or we need a special meeting just to discuss that, we can certainly call one. So
Yeah, I think it shouldn't be too controversial. I don't think, but I, you know, obviously need everyone's input. So
well, we're very,
off the side there, Doc, remember we have an August 9th Chiefs meeting that I've invited
Okay.
you to already. Hopefully, if you're available for that one, we've got some issues around the House Bill 1013 that I even think the sheriff will be at the same meeting. So I think it's probably one of the important ones that you could bring that up. So you kind of, I'll say you kind of greet the skids and kind of let everybody know it's coming. So you might be able to move a little quicker than we think. So
got it. And I may not be able to make that meeting. That's unfortunately my week. I'm back in the ICU, and I think the meeting was in the morning, if I remember right. So
9 o'clock. It's a 9 o'clock.
yeah, I'll be rounding, so I unfortunately won't be able to make it. I'm sorry.
No worries.
well, thank you for everything all of you, both you and Chief McKernan are doing on behalf of getting this. I know there's a lot of pieces to put in place, and if we can get all these strings together and you know, before as fall hits, that would be really great. I wanted Apple.
Sorry to interrupt. I know you're moving on to other things. I just want to make one pitch. As I move into my new position, which starts in mid-September, we have a subject matter expert in our building, obviously Margie, who's done a lot of naloxone education and distribution, as well as harm reduction, training, whatnot to staffs. Her team is getting built. We're building a bigger team so that she will ostensibly, in theory, if I leave this group, because I have other things to attend to, I would like Margie to take my place as a representative of community health and as a subject matter expert with working directly with the community, having a great deal of insight and perspective on South County folks who utilize our services, and in helping you all grow these things. She actually has a ton of experience with the UW program that you mentioned earlier. And so it sounds easy, and it is, but the mechanics of doing it in real time with clients is something to learn. It's a sort of a workflow concept that she could obviously give good insight onto. But I want to recommend that. I haven't talked to her. She's been so inundated with COVID for a year and a half. But now her team is growing, and we are actually recruiting and hiring. We've been successful in hiring 2 people. So I think she'll get back to being able to do more partnership type things such as this, if that's an okay strategy by you all.
Okay, great. Well, we'll look forward to when she comes up and available.
Would you be able to introduce me to her? Because I wonder about using her to help teach, or we also do some small group, more facilitated small group work, not at the bigger sort of more lecture-based teaching, that I wonder if she could attend and help people practice with simulated patients talking to folks or something. That could be kind of a cool.
She probably
Education.
could, and that's the kind of wheelhouse she hasn't been able to do much of in the last year and a half, so she might be real interested. Is there a way, could I strike up an email with you on behalf of that tagline? Okay, thanks, Dr. Ball.
Great. I'm going to switch things out of order a little bit on our agenda and have Sheriff Nole go next with his discussion about the South County area and navigator and some data that I know that Chief McKern was interested in. And I know that Sheriff Nole has to leave early, so we'll fit him in and then jump back on the schedule.
Yeah, sorry about that, but yeah, I have to leave early, and I thought, how am I going to let Lori know? And then I remembered the chat thing. So, but yeah, I apologize for that. And the navigator was going to be here, and I'm thinking, where is he? And now I'm thinking I forgot to send him the link. So I'm taking full credit for that right now. But I compiled some numbers yesterday. They're not as concise as what, and I talked to him yesterday. They're not as concise as what he could provide, but I went through all the cases that he's been involved in throughout the county and came up with some numbers. So as far, and I was under the impression that's, I know that one thing, people wanted to meet him, and so perhaps at the next meeting. But so the numbers that I came up with, and I don't know if these are actually, he told me that there's things he does that don't get case numbers. So like phone calls to people, follow-up, things like that. But as far as things that he's gone to and helped out and that have been considered either mental health, substance use, things like that, there's been 39 calls since he started near the end of March. And we got a slow start on the grant, the contract and all that stuff. So anyway, for South County, and so what I did is I ran the numbers from January 1 to yesterday. And so just for what it's worth, Gardner, there's been one call he went to there. We break it down to Lake Leland area. There was one call there. Quilcene, one call. Coil, 0, and Brinnon had 8, which I thought was kind of interesting. And then just to reflect up north here, Port Townsend, Cape George area, that doesn't mean in the city, but outside the city. There were 4 calls: Hadlock, Irondale 7, Maristone 4, Chimacum 5, Ludlow 1, and then also Ludlow in the Shine area. Ludlow's kind of broken up into 2 areas. There were 7. So if you want to say 8 calls in Ludlow. So 11 calls down south, 28 up here. And again, there's been other numerous things that he's done. And we're still, the reporting system that the state wanted had a glitch, and they just finally got that up and running. So I don't have access yet to where I can pull up. We do a monthly report on all the things that he's done, outcomes, if they went to, if they, didn't go to jail, went to the hospital, things like that. So, but I don't have access to that today. And if he would have been here, he could have talked more about those kind of things. So, but
Sheriff, do you have any breakdown between substance use or mental health issues in those numbers at all?
Not the ones I have. I could, but yeah. My thought, just from knowing and seeing the calls come in and stuff, the majority of them would be mental health. What it's worth. Yeah. And yeah, I mean, and I don't know if everyone knew, but it was being called an active shooter out on Agonai Road on Sunday. And a guy who we've been dealing with for the past couple months, thinks that his neighbors are turning his electricity off, turning his computer off, all kinds of things. Well, he went, I was going to say he went crazy, but he had a breakdown, if you want to say, and started shooting his guns and shot up he lives in a 5th wheel trailer. And shot his trailer, hundreds of rounds. And some of the rounds hit neighbors' houses, and that's how we got involved. But anyway, the navigator was called out and went and helped out with that. So just thought I'd throw that in there.
Sheriff, was that an arrest then? If he's shooting guns, and did he get arrested because he was?
Yes, he got it. Yeah, good. Yeah, he did get arrested for what's called reckless endangerment and aiming or discharging a firearm. So they kind of go hand in hand. Yes, and then he saw, I know that yesterday they took him, a DCR, a designated crisis responder, came out to the jail and met with him, and they ended up transporting him to the hospital to do a more in-depth analysis, review, whatever, to decide what to do next, because he's definitely a danger to other people. And he didn't want to talk about why he was doing it. So it looks like, from what I know and from what I've read in the reports, that it was something not aimed at other people. You know what I mean? Not like he was trying to hurt other people, but he didn't want to talk about what he was doing. But we're presuming from past experience with him that maybe he thought people were coming to his house or trying to get in or something like that. So, and I don't know what the final outcome of. I left before we knew what was going on with him once he went to the hospital.
A question I have, based on being part of the RFP or the hiring process for the navigator, is was it appropriate that he wasn't the DCR? This is just a question that's still with me. There's an opportunity to have the navigator also be the designated crisis responder, I think. And is it good that they were, decoupled in this instance? And that's maybe a question for the future. I don't know.
It may have been helpful. I mean, being that he was a DCR, or you could say is a DCR. I mean, he doesn't work for the right place that makes him have that title. He knew that more should be done, but I was involved again with the grants for WASPIC, and very, very few have DCR. The main ones that have a DCR, they just contract with, like, let's just say DBH, and they run the thing all on their own. And so they aren't really like tied in with the law enforcement agency. My preference would have been to have it be one-stop shop, but it didn't work out that way. So I don't know if anyone has any other questions about that. Yeah, Tim, or Chief. Sorry, Chief.
That's okay, Sheriff. Hey, so we had a case already. We had a case on Saturday that we probably could have used the navigator. Should we just reach out and call him, or?
That's a good question.
We seem to, this may be hand in hand with our August 9th meeting, that we may want to come prepared with that, because I know things are going to change with the House Bill 1013 come to play. But yeah, we had a true case where I actually the status, my crew was silent, so we ended up getting some help from you folks to come out just to make sure the crew was okay. But she definitely, I ended up doing the phone conversation with the family that probably the navigator should have had, and not the fire chief.
Yes, and that's something that's very helpful, is having someone that's not only trained to do that, but it frees the work. I mean, he's working too, but it frees the workers up to do the other part. And this was the first time in my knowledge that he's been called out. So and he lives in Cape George, so that's not like he lives in Kitsap or Port Angeles or something. So and I know we do want to have that be more available. He actually, when we were talking yesterday, he's talking about adjusting his schedule to come in like at 10 or noon and then work into part of the evening too. So which I thought that was a great idea. I know other agencies do that. You try to, when you only have one, you try to spread them around the best you can. But but how that mechanism would work, usually if the deputies are coming to respond to a scene with you, I would hope that maybe they're already thinking that. I think we still need to get used to the idea of, call the navigator out, but we can, I don't know if we want to talk more. I could see something like where maybe that he could be requested through dispatch or something.
I just want to make sure that dispatch knows so that when we, my crew goes, when they leave and they say, okay, well, the resources, what are my resources that I need? And I'll talk to our crews here to make sure they understand, let's get the navigator started.
Yeah.
In this particular case. So.
Well, then you probably know, in this, anyway, that there are some fire districts or stations that are having navigators within the fire service. So Port Angeles has one, but that's
correct.
It's kind of few and far between, but how that could pan out in the future. But unless we start using him in those situations, we could figure out ways to do things, and so I'm all for that, and he's here to help us all. So
then Sheriff, how is it set up funding wise? I know we had funding through, I forget whether it was July or September, and then we were going after more funding. Are we all set on that?
Oh, well, so we got the grant again for the year. It was and we just got the final or the official notice the other day. But we got 116,000 or something. It was about 10 grand short of what we asked for. We still, I think Andy we're sending up the contract for review by the county. He's back today. It might be going out today or tomorrow. So we're in that process again. We have to go through the whole thing again. We have to do the RFP and all that. So how that's all going to work out, I'm not sure, or what it's going to be, but yeah, so we're looking good for another year. And
Another year. So we're good through next June or next September? A year.
It'll be through next June.
Next June. Okay.
Or July, however that, yeah, June or July. I don't have the specifics right. If you would have asked me a couple of weeks ago, that was front of my brain. Now it's like, I don't know if that's really how it works.
Congratulations. Congratulations on getting that funding. Yeah.
Yeah, we were pretty pleased with that. Would have been a shame to just done a month or two of work and then have to drop it. So
yeah. So is there anything, I know, in terms of just having the open space, this table where folks can connect on things like this, you and Chief McKern and Dr. Carlbom, is there anything else that we can do to support the connection that you and Chief McKern were talking about in terms of
I don't know. Not that I can think of.
Okay.
But that's one benefit of having meetings like this. I would have never thought that fire chief might want to have a navigator come somewhere.
Well, I'm really happy we've got a South County little table that we're set up here. Zoom has really made that much easier. It really has.
I am too. And I think South County gets neglected.
So
by the
so
fire department, not by the sheriff's office.
Ever.
So, and I think that's great having a group to focus down there. And,
I was looking to see if Chief McKern smiled when I said that, so he knew we were joking. All right.
yes.
That is his smile. Okay.
Sometimes I say things I shouldn't, of course, and then I remember, we're being recorded. So anyway.
Okay.
Fire department, they're number one. And
okay, that's the part we'll highlight.
yeah.
Anything else on that topic before we move on? Apple?
Just to synthesize, and this for my own processing, well, a lot on my mind. It sounds like there's interest. There is some workflow integration that is required if this is to move forward to sort of integrate the navigator with the fire departments. And it sounds like everybody here is good with that. So I don't know how I or we could be helpful in that, but I think what you just said is kind of the essence. This table is the right place to make, to work through workflow ideas and get ideas from the group. So,
well, and I think you're exactly right. I think the willingness to work together and stuff
Part of
I know is definitely there.
Yeah.
And then who knows, the chief and I will talk, and no, he'll probably come up with stuff we can put off on other people to do. So
Then we'll invite them to the meeting.
yeah,
Thank you
give
so
it-
much, Sheriff, for bringing that
we'll give it-
information.
we'll give it to Frank Redmond and he can pull it all together.
Yeah, Chief
Frank is
McCurry,
a doer. He gets stuff done. Don't
that's
you?
what we like about him.
So Apple, I think some of your questions, I think a lot of the questions in the unknown for the sheriff, and Sheriff, I'm going to speak a little bit for you, is that once we get together here in the next couple of weeks, we are trying to set the plan. We are trying to set forward the plan as far as a policy goes. There are places like Spokane, Skagit County, Port Angeles that all have a community plan, so that then when we need to make it black and white to dispatch, that they know to call. We don't have to get there and say, oh, now we're in crises. Oh, now we've got a law enforcement issue. Oh, now we need our navigator. And we're already 30 minutes into the call. You know, the call we had Saturday should have been plain and simple. You know, you get a call for a suicidal, you know, and it goes through the whole process. It's like, this has navigator, as far as I'm concerned, has navigator written all over it. And so certainly that's one of those things that, you know, as a dispatcher, you should be able to know, hey, this sounds bad. Maybe I'm going to start a helicopter. That's probably a good plan. Let's start a helicopter. So I think you're going to see that, and I'm not speaking, Sheriff, I know you're part of this process, is that we're going to get something together. And I know that other counties have done it. I've sent some information out to all the chiefs. They're very active, and Chief Black and the rest of the chiefs are very active in getting this House bill taken care of and kind of narrowing down the focus. And it's really going to be black and white. It's going to say, here's what we're responding to, here's what we're not responding to, and here's what we're going to do. So I think it's a good time. I'll just say news at 11 because the sheriff and I still have, he's right, we still have to meet. We still got a little bit of homework policy wise to, it won't get to Commissioner Brotherton yet, but I'm sure you'll see it within due time.
And that's, you know, one reason, well, the reason I have to leave early today is we are having a, all hands meeting, all the deputies, all the supervisors, just to talk, and the prosecutor, to talk about how we're going to be moving forward with the new legislation, and that 1310 is part of it. You know, how are we going to, what can we respond to? When do we need to walk away? Is it really true that we need to walk away? You know, all that kind of stuff. So, you know, one thing I can say is we're not going to be an agency that just says, you know, nope, can't do anything. And we're not going to get ourselves sued either. So, but you know, we're here to help and want to, you know, with the community and whatnot. So we're not going to let that go away.
This anecdote, if it's any indicator, I had someone call me last night to apply for a nursing position here, and she was actually wanting to know more about this House bill and what it might do as far as trickle down to nursing professionals who work in behavioral health and how they might be redeployed in a more public health manner. And of course, I know about the bill, but I'm learning this sort of strategy through you all at this level. But that was fascinating to have someone call me and say, what's going to happen and are there going to be jobs? That's what I want to do. So interesting.
Yeah, see, there you go. Now it'll be, we'll be calling your office to send out a nurse to go to the scene.
I mean, I don't know. I'm not
Enforcement
saying that
can't-
needs to be the case, but I just thought that, you know, that's a little note to tick away.
No, you're right.
People are listening.
And the other thing with all this too is, you know, no one really knows how it's going to exactly work after July 25th.
Right.
The trial and error and waiting to see for someone else to mess up and go from there.
Well, the AG is going to give clarity in a year or so, right?
Yes, in a year they'll have a plan on how we're
And
supposed
then
to do
they'll
it.
have all the rules.
Yeah.
Yeah, that's perfect time.
First we pass the rule, then we get a.
Sounds like COVID.
Okay.
Well, I'm sorry. So I'm going to have to run. And
Yes.
I apologize for not having the navigator here. But I will do my best to get him to the next meeting. So
And
thanks.
thanks so much for what you did bring. It was very, very helpful. Very helpful.
Yeah, I was scared that there was going to be no calls down south, but then I thought, well, that's a good thing if there's no calls down south. So anyway, we're all the same. See you later.
Okay. Thank you, Sheriff Nole.
You're welcome.
I know we're skipping around a bit in our agenda. Commissioner Brotherton, is there anything you wanted to give us in terms of update about anything, Jefferson Transit or anything else you'd like to talk about?
No progress on Jefferson transits. No, I don't think I have a South County. Nope, got a Spark Joy grant to do hiking with the local down in South County. So I'm going on my first hike on Friday.
Very nice.
Mount Walker with an old logger to get some local color to add to virtual hikes, but no harm reduction stuff in South County.
Okay, all right. Any questions for Commissioner Brotherton before we move on? Okay, I just wanted to log the thought with this group. And some of you I have talked to, and some of you I haven't. You know, I was able to have a conversation with Trish Bethard a couple of weeks ago, just as we were talking about sort of what had been presented at that JCEP meeting and what she was thinking. And we were able to clarify between the two of us in that one-on-one conversation that in fact, we're not looking to keep naloxone at Brinnon so that anybody can walk in off the street and pick it up. It is just to have in place like you would an EpiPen or a, AED or a fire extinguisher. It's part of your life-saving sort of toolbox. And that was a good conversation. And what she said was she was, open to the not just open, she thought it was a good idea. What she would want to see in place before she brings naloxone in any way, shape, or form in her school, which is an elementary school, and I understand her careful reservation there, is that we have a distribution place in her mind, in Brinnon at least. It should be the fire department where the supply is in, it's been publicized, that it's available there, so that it's very clear that this is something that the whole county is doing as a sort of a life-saving measure that we want to have in place. And so I say that to this group just to clarify, indeed, we are not looking to have people go to any school and just randomly pick up their naloxone. And also to say that it's important that we figure out the distribution place before we can take that step, at least in the Brinnon school. The second thing I wanted to tell you is that Trish also gave me the name of a couple of people. We have been talking about how we want to have both the naloxone side of things taken care of, but we'd also like to get some faith-based opportunities for support along the recovery journey that we're active in supporting, and we've got them going here. And to that end, there are two representatives. One is a faith-based rep, Greg Gismer, and I don't know if any of you guys know who he is. I've been trying to reach him. I've sent him a couple of emails. If anybody knows him and runs into them, vouch for me that I'm an okay person to return the call to. I'd like to get him at this table because it seems like he might be at least a toehold down that road of how do we get something that is truly supported recovery circle support wise down there, and whatever else we can think of that could be supported from a faith-based perspective. And then Trish also recommended that we get in touch with Alicia Simmons, who is in charge of or managing the Brinnon Community Center, and perhaps have her here to represent the ways in which we can connect and integrate with them in this process. And of course, Trish also said she thought it was important. If we were going to get naloxone at her school, she wants to see it at the little grocery store that's there. She wants to see it at the post office. She could think of other places that it should also be if we're going to be concerned about having no overdose in the parking lot at the school. There are these other places we should make sure to have such a life-saving device available. So any thoughts about those two things before I jump on? I'm just trying to catch us all up so that we're all calibrated.
Our board had a follow-up conversation after the JCEP meeting, and they're more open to the idea now. And so we will be discussing that as a board in an upcoming meeting to talk about how we might have it sited here on campus, at least as a first step, and then pushing into the
next steps.
The next steps as time goes on. But so I appreciate you coming and presenting, because it changed the mind of the board member who was there for us.
Oh, that is great. That's really good to hear. Now, if there's any way we can support you, Frank, and whatever the next steps are, just tell us. We're there, but we don't want to overstep either. So
I'll probably be sending an invite to an upcoming board meeting. It may be September. August is already filling up, but have you do a similar kind of a presentation with you and Dr. Carlbom to come and just kind of talk about what it is and what you're thinking about, and if that could be backed up with some of the numbers of times when such a thing would have been useful in South County, so it becomes a little more real to the board. I think that would be really helpful. Having the data to back up why there is a need for this.
Okay.
Be a good part of the story.
Okay. Chief McCurry, if we were going to try to get a hold of that kind of data, do you have a gut feel on where I would start to talk about and ask?
As far as the information,
Data that would support, it would be good to have naloxone because these are times or opportunities when it would have been useful to have on hand, or this is the amount of times that we, over the course of the last year or 2 years have responded to a call that involved.
Some kind of student, is that what you're thinking?
Not just go ahead, Frank.
Not just students, but we don't believe that there's a large number of students who would need this, but we recognize there are community members, parents in particular, who may. And so if we were to get more community-wide, not student-specific data about the need for naloxone in lots of places, and that could just be represented by, in the Quilcene school district, there have been people who live in the Quilcene school district, there have been this many times when we've had to or needed to administer naloxone. Something like that.
Right.
We need the data.
I wonder if the hospital would have that data based on addresses, zip codes, because I know that overdose is a reportable condition. And so, if they ran that data based on zip codes, anybody who had to show up there.
Right. And then we qualify that with, and then we can also qualify that with the fact that not all of them get reported to the hospital because there are folks who have the kits who don't do the notifiable conditions. Okay, that's a great idea, Frank. We're going to run down some kind of data so that it brings it home to a much more local landscape for your folks. Any other thoughts on that piece? Okay. School-based health center and support for naloxone training or CPR training plus naloxone, however that goes. Apple, did you want to talk a little bit? I know we were able to meet with school-based health centers, Susan O'Brien, and I think that there was a willingness to support, whether it's the fire chief giving that. I don't know who gives the training at the school before the school year starts or if it's just after the school year starts.
Well, I'm not sure I can speak too specifically. Unfortunately, I've been in the crossfire of too many changes. I do show up to these meetings, and obviously I'm in contact every day with Susan and Melinda, our two providers who span the school-based health centers across our county. What I can say that I do know is that there's interest with both of them to support whatever in-school version of this is deemed necessary or approvable by the school. I think they are beacons of the sort of trusted provider angle, if you will, to help folks understand the value of these added supports and benefits that they may have stigma against or otherwise just have misinformation about. Now, Dr. Melinda is newer to the community, so she really can't hold that kind of community place in Quilcene. It's growing, obviously, and it's growing first and foremost, among the administration, where she's having plenty of interaction, at least before the school ended for the summer. And then it's slowly trickling down to students who talk amongst one another, and then clearly their parents will hear about it. I think, you basically have them in your corner for any education. That's certainly what Susan has plenty of experience doing already in Townsend and Chimacum.
She was able in Chimacum, I think, to support who led the training, I think they had some staff and administration. And we had talked at our last meeting about the possibility of if there was training that was going to happen for school admin staff, whoever it is, sort of the preschool or the just after you've gotten into the school year, if there was a CPR training or something that we could just add a short naloxone component to, if the school was interested in that. It's something we can talk about. So I'm just laying the idea out there.
Yeah, I think they are completely interested in being deployed to add to those kinds of events. You know, wherever administration feels that's helpful.
Mhm.
They have the knowledge. The thing about them is that their ease with the technology is pretty basic.
Right.
But it does frighten people. You know, it seems like a medical procedure, yet anybody can do it, right?
Right.
So you kind of have to take the intensity off of the supplies and the circumstance and help people see that the direct application of utilizing these small bits of supplies can save somebody's life. It's how CPR is promoted. Anybody can learn CPR and utilize it. And you never know when you'll have to. But I think the providers in the school-based health centers are a really great source of advocacy to help explain and put it sort of in plain terms, but also coming from medical professionals, which has a certain quality to it.
Yeah. Thank you. Any questions for Apple on that one? Okay.
I think it'll have to be an ask from you all. So whatever the ask is, make it as specific as you can and run it by them. They won't run into any hurdles on this end for sure. It could definitely be part of their time out at school. And they're in the schools a lot come beginning of the school year.
Well, when we get to that place, we'll just leave the door open with Frank and you let us know, Frank, how we can be supportive there. And that brings us to, I think, our last thing, which is, I'm sorry at the beginning, I didn't have everybody introduce themselves. I know that Denise has to go. And are you leaving right now, Denise? Okay. All right. So Denise, let's have you tell us a little bit about the grant that you've gotten to do the prevention work down there. And I know it kind of ties in because prevention, naloxone, but in general, we've got a good table of people here that are relative.
Thanks. Yeah, I have to jump off in just 6 minutes. And so what I want to say is thanks to Chief McKern for extending an office space for Alexa Schmier in the firehouse down there while she does her community capacity building for this coalition over the summer. And then Frank knows about this and Greg also knows about it. I think pretty much everybody knows about it, but there is a new community prevention and wellness initiative, cohort 7 grant that has been approved for the Quilcene community. And what that grant brings to the Quilcene community is a partnership with the ESD, which is the Educational Service District Unit, to supply a student assistance professional who works in the school district as basically a counselor for indicated students and a group counselor also. And then it also provides a coalition. And so Jefferson County Public Health will be hiring a coalition coordinator to work in the Quilcene community. And we'll do that with Sean on board for those interview processes, because we know how important it is for Quilcene to hire people who are who fit the community. And that will provide, that coalition then will be represented by 12 sectors of the community and will work to achieve substance abuse prevention programming in the school district as well as in the community. And Greg is a member of the coalition already, and he is also the government representative on all 3 of these coalitions throughout the community. These coalitions bring in nearly $1 million every 2 years to the community to do drug and alcohol prevention work, which I think is a substantial amount of money. And this grant goes through March 14, 2022, 2023. And they're generally renewable grants. I've been working under a grant like this for the past 6 years. And prior to me working under this grant, there was another woman who was working under this same grant. So these are pretty stable funding sources through the feds and the state government. So we're looking forward to making this thing a robust program in Quilcene, and I can't think of a better community for it because Quilcene works so hard and as such a great team to get things done. And so we're really, really looking forward to working with the school district there. So yeah, anybody
Denise.
questions or thoughts? Yeah.
I want to say congratulations on that grant. I mean, to have this set up in all 3 school districts, I think is such a huge thing. And I don't know if we celebrate enough when we get these substantial grants coming in, and we really appreciate your work, Denise. And thank you for being here and for fitting it in before you have to run to the next one. All right. Do we have anything else before we tie up today, Greg?
Yeah, I just, in the good news category, I did want to tell Frank that the BOCC still has some CARES dollars left. And we decided to give some pretty unencumbered dollars to all the different school districts. So we'll see each other tomorrow and talk, but I think we have 50K for the Quilcene School District.
That's great news. Thank you.
That is great news. All right. Anything else, Chief McKern? Nope. Okay. All right. So we'll go forth. We'll see you next month. I'll circle back as I know more. And thanks so much for coming today.
See y'all later.